Hey folks, welcome back to my channel, LA Living Life. I am so overwhelmed and so overjoyed because today was the launch day of the first video. And so by this time, you guys would have already seen my miscarriage story. And I am following up today to tell you guys about my myomectomy story. All right. I just want to tell you guys, thank you so much for all of the shares, all of the likes, the subscribers. I say this is my story because I believe it's just a page in our book. But I also believe strongly in testimonies, right? And the Bible says that we overcome by our testimony. And so someone told me that, this is going to be very therapeutic for me. And it is. It is. Anybody that knows me knows I'm very transparent. If you ask. But I know there's other people that would like to hear this story, but a transparent version of the story, right? I know there's many other people that you guys can go and listen to, but I am so eternally grateful that you chose to come and sit with me again. So once again, like, share, subscribe, share on your social media pages. I would greatly appreciate it, and I greatly appreciate the support, and I love you all. I love you with the love of the Lord, as they say in church. But yeah, today let's talk about my myomectomy journey. So on March 14th, I went in for my open myomectomy. Just a backstory in case anyone wants to know. The doctor that I chose, not that I chose, but I was referred to do my myomectomy was Dr. Jonathan Black. I guess I did choose him because I didn't have to go with him, but I trust the judgment of my OBGYN. But I also looked him up and I saw that he was highly rated for what he does. So I went in to see him the latter part of January, and he sent me to do an MRI so that he can get a clear visual of what he was going into. At that time, he had set me up for a robotic myomectomy, but he did advise it may need to be open myomectomy, dependent on where the fibroids were located. And so sure enough, I did the MRI. About a week and a half later, his office called me to let me know that they will need to do an open myomectomy because of where the fibroids are located, and because there are multiple fibroids in the same exact space. He will need to have a good visual to see where he's going. So I also had to get cardiologist clearance, which fortunately for me, I was already under the care of a cardiologist. Just a little bit of backstory on that. When I had my miscarriage, a part of my recovery was that I had some tachycardia symptoms. And so it was a sinus tachycardia, which means your heart's fine. It's just responding to infection, or it could be responding to anemia, low blood count. And so in my case, I had both. After my miscarriage, as a result of my miscarriage, I had developed an infection in the hospital, as well as I had lost a lot of blood. Remember, I had to get the blood transfusion. So due to that, I was on the antibiotics to rectify the infection, also on iron tablets to get my blood count up. So about December going into January, the tachycardia symptoms started to subside a lot. However, at nights, I would wake up to a racing heartbeat. So that was concerning for me. And I decided to go ahead and see a cardiologist. I actually went to the ER one night in January because I just felt like my heart was racing too fast at night. And I had a heart monitor and I put it on, and it was going between 115 to about 120. That was scary for me to wake up to a pounding heart rate like that. So went to the ER. They found nothing. By the time I got to the ER, my heart rate was down to like in the 80s. So they were already looking at me a little weird. They were like, are you sure you're not just having nightmares, panic attacks? They did blood work to make sure I wasn't having a heart attack, stroke. They did a chest x-ray, and everything came back clear. Everything came back clear. As a matter of fact, sitting in the hospital, my heart rate went down to the low 70s. Which to that doctor, he's like, you have a perfect heart rate. What's the problem, right? Yeah. So I went to a cardiologist, Dr. Kevin Bender, and he was able to set me up on a heart monitor for 2 weeks. And he also had me do an echocardiogram, which can see all the chambers of your heart, make sure your heart is pumping correctly, it's moving blood in and out as it should, and that your heart just looks good, structurally looks good. So I went, did the echocardiogram, the results from the 2-week heart monitor came back, and he said my heart looked good. He said there was no issues. I'm a healthy young lady. So the reason for the nighttime racing heartbeat, I don't know. I don't know. Someone kind of spoke to me on it in the hospital when I went for my myomectomy surgery, as a matter of fact. And I'll tell you guys what she said when I get there. But my cardiologist had already cleared me, so he was able to send a clearance in to my to Dr. Jonathan Black, who was going to do my fibroid surgery. His specialty is OBGYN oncology. OBGYN oncology. So he wasn't my regular OBGYN. He's just a specialist for certain procedures. So I went in on 3/13 to do my pre-op labs. The hospital that I got this done at was HCA Florida, HCA University Hospital in Davie, Florida. Immaculate hospital, guys. I loved it. I loved the care. I loved the cleanliness of the hospital. Everything was just smooth. So they did my pre-ops on 3/13. They made sure to actually send blood to the blood bank to make sure that they had some blood available for me. Since I had my blood transfusion within the last 6 months, they need to make sure that the blood that matched my blood type had specific antibodies to match my current blood due to the transfusion. I'm not a scientist. I don't know the science off the top, but I just know that they said when you have a blood transfusion, there's antibodies that stays in your blood for about 6 months. And so they have to make sure it's a proper match in the case that I needed blood. So they took blood for that, as well as other labs to test my blood levels prior to the procedure, so they know going in whether I will be needing blood or not. And on 3/14, got ready to go in for the procedure. We got there for 11:30 because that was my time. They said don't come any time before that. So 11:30 was my time to go in. At about 12, I went into the room for pre-op where they gave me my IV drip as well as prepped me for my surgery. Prior to surgery, they give you this, it's a body wash that you have to wash with pre-surgery. So you do it the night before, the night of. I also had to fast for surgery. The only thing I can drink was they have Ensure Clear liquid for surgery. And so I drank one the night before. I drank one the morning of. In the pre-op room, like I said, they put in the IV drip for you, as well as they make sure that the needle's big enough in the case that you have to have a blood transfusion. So I appreciated that they did that initially. When I was at Jackson, they had to switch the needle because the initial needle that they gave me wasn't big enough for a blood transfusion. But at HCA, they do all of that in the pre-op. At about 3 o'clock, my doctor came in to talk to us about the procedure. We were told that it was going to be a few hours. He said, nope, it was just going to be about 30 to 45 minutes. And then my nurse came in, and they already told me, once your nurses come in, that means it's time to go. So the nurse came in. He told me that he had my cocktail for me. Once he gave me that cocktail, guys, I was out. And it wasn't anesthesia. It was simply a cocktail to relax you. And I was relaxed. I don't even remember anything about that. And you're going to see a video now of things that I said to my husband I didn't even know. But I think I said something to the extent of, are you still going to love me even if I look like this? And he was just laughing. He said, yeah.
She's like, I have the right of way.
So the waiting room is going to be through.
All right, babe.
See you in like 45 minutes.
Okay,
Try a little longer.
Yeah,
even though I'm going to be drugged up and all that.
A little longer.
But yeah, they took me in. And based on what my husband said, it was about 30 minutes. In that 30 minutes, they removed 9 to 10 fibroids. 9 to 10 fibroids. The only thing I remember is waking up in the recovery room and wanting to vomit. I immediately wanted to throw up. I just felt very uncomfortable, but then I was also in and out. So it was very weird. I would wake up, see the nurse, tell the nurse I need to throw up. She would be like, no, not yet. You gotta wait. I'll be out again. Wake up, tell her I need to throw up. I'll be out again. But probably about after 2 hours in the pre-op room, then I was able to go to my actual room. And you'll see footage of me going to the room as well. My husband did not catch footage of how they were able to get me over to the other bed. And I don't remember. I don't remember much. I think I just remember waking up later on in the evening and telling my husband I needed to use the restroom. And that would have been that day. I got up and I walked to the restroom. Wasn't easy at all. But I did. Wednesday was somewhat kind of a normal day. I know that I was, once again, kind of in and out. They had me on some pain medication. Fortunately, I didn't have to ask for the pain medication. They would come and ask me if I needed my pain medication because I just wasn't in that much pain. It's more so discomfort. I'm going to fast forward a little bit. Well, let me just say, while they were taking my vitals on Wednesday, I was, of course, tachycardic, and my blood pressure was really, really low. Not abnormally low, but pretty low. It was getting there. And later on in the evening, at that time, it became abnormally low. So they came in probably late Wednesday night, early Thursday morning, and they took my labs again. After taking my labs, my nurse came in and she said, your blood levels have dropped. So things are going to start moving a little fast. I already kind of knew what that meant. Not really. I just thought it meant that I was going to get a blood transfusion. But it was when my doctor came in and he said, you're losing a little blood. So it looks like you may be having some internal bleeding. So we're going to go ahead and get you set up for a procedure to stop the bleeding. Within 30 minutes, they came and got me to do a uterine embolization. Because I was already on anesthesia a day and a half before, they did not put me under for this procedure. I was wide awake. They did completely numb the area, so I didn't feel it. However, it was uncomfortable because I was on a cold, flat surface. Cold, flat surface. Can you imagine having a major procedure on a Tuesday, then having to have another major procedure on a Thursday, wide awake on a cold, flat surface? It was very, very, very uncomfortable. It was so uncomfortable to the point where when they were done with the uterine embolization, which I didn't feel much, just a lot of discomfort, at the site of my initial procedure, when they took me to the post-op room, I needed to use the restroom and I couldn't pee. So they had to put a catheter in to help me to get some reprieve, because just staying in that position for that length of time, I guess it did something to my body where now I just wasn't able to use the restroom. So they put the catheter in. That made me feel a little bit better. But then I started feeling nauseous, very, very nauseous. And yes, I did throw up in that post-op room. I remember my husband and my mom came into the post-op room and they were like, okay, we're going to send your sister and dad in. And I know my dad, he's a crier. And I said, no, don't send him in. I said, don't send him in. Just wait. Just wait. Because I know if I felt the way I felt, that I would look the way that I felt, which wasn't good. By the time I went back up to my room, my family was there and they were just looking at me like, I don't know if it was shock. I don't know what their feelings were. But, you know, in hindsight, they let me know I just didn't look good. Just didn't look good, to the point where my other family wanted to come and see me and they turned them away. They told them, no, don't come see me right now. I looked pale. I just looked sick. I looked fragile. And so that day I had to be on complete bed rest and I can only drink liquids. So that was a day. I felt nauseous for most of the day. I don't think it wasn't until later in the evening, after sundown, that I started feeling a little bit normal and like myself. But I slept for most of that day. My family even left because just them talking was too much for me. I kind of offended my sister. I'm sorry, Tanika. Because I had to tell her to stop talking. It was just too much. Everything just felt like too much for me. I don't know. It just, I wouldn't say, yeah, I felt spaced. I felt very spaced. I felt dizzy. I just felt nauseous. And so to hear noises was just the worst thing for me. So a lot of that day was just a daze. It also was very reminiscent of when I had my miscarriage, and just something after the other just kept happening. And I think in that day too, I became fearful, you know, and if you know, you know, I just became fearful that, something else is going to happen. They also gave me a blood transfusion that day. And as soon as they gave me the blood transfusion, I actually started to feel better. So as soon as they gave me the blood transfusion, I started to feel better. I felt as though I could rest. So I did rest a little bit that day. And I know that that's also what contributed to me feeling better in the evening. I was still on bed rest in the evening. However, they came, they took more blood to see how I was doing. And so within that day, less than 24 hours, I went from a 7.8 in my blood count to a 9.2 that Friday. So I would say that tonight, Thursday and Friday, I jumped up to a 9.2. So they were able to stop the bleeding. I started to get back to normal. I still had the catheter in all day because I was on bed rest. But by Friday early morning, they removed the catheter. They told me to let them know when I'm able to get up and pee. Probably within an hour, I was able to get up, walk to the restroom and pee. I was also able to get up and start walking. And this time, my husband and I, we took a long walk. And I felt good. I felt good. The nurses had to keep coming to me like, do you want pain medicine now? I'm like, no, I feel fine. Aside from whatever other symptoms were going on, I felt fine. Still no real appetite, but I wasn't too concerned about that. Usually when I'm in the hospital, I don't have much of an appetite. I didn't have one with a miscarriage. And so I knew it's just being in the hospital, being in that environment, anticipating that something's going to come up, right? But I was able to walk. I was able to pass gas between the Thursday and Friday. Like all the milestones they wanted me to reach the Wednesday, I was able to reach that between the Thursday night to Friday morning. And so my doctor came in early Friday morning. He said, how are you feeling now? He let me know that they were able to stop the bleeding. He asked me, what do I need from him? At that point, I just wanted to go home. And he said, all right, well, I think we could do your discharge paperwork today. And sure enough, they were able to do my discharge paperwork, and I was able to go home Friday afternoon. Came home Friday. My family was so scared because we have stairs in my house. They didn't want me to have to take the stairs, but I said, let me try. And sure enough, I was able to take the stairs, hop right into bed upstairs, and I was out for the night. Yeah. So Sunday, I had to go back to the ER because I started to feel warm. I didn't feel sick. I just started to feel warm. And based on what I experienced with my miscarriage, I knew that if I started to feel warm, that could be a sign of infection. So I told my family, hey, I need to go to the ER. Went to the ER. They ran all tests, like the full scope of tests that they needed to. They took blood culture, they took urine culture, they did a chest x-ray, they did a CT scan of my uterus. They took everything, and everything came back good. Everything came back good. They were able to give me some IV liquid, some IV. And that was able, between the IV and the Tylenol that they gave me, it brought the fever down. And so they discharged me within a couple of hours. And what happened is my doctor advised them to prescribe me some antibiotics for 7 days, 5 to 7 days. And that's what I did. I took the antibiotics for 5 to 7 days. In the meantime, I would get up and walk, at least walk to my mailbox, which in my community, my mailbox is across the street from me. I would walk. I would try to eat healthy as possible. I didn't do it well all the time, guys, but I did eat as healthy as possible, to the point where at this point I've dropped 11 pounds since my surgery. So I was eating healthy. I'm walking around, taking the stairs frequently. And I felt good. I felt good. I want to say that my doctor's precision in the cut is what has helped me to heal so quickly. I really have not been in a lot of pain. If anything, I feel more pressure and soreness in my lower abdomen, but not pain. In the second week, which that would have been the time I got home, right? Because I was in the hospital from the Tuesday to the Friday. So by the time I got home, it would have felt as though I was just doing 1,000 push-ups a day. That's how sore my stomach felt. But then, by this week, I don't feel any pain. I wasn't taking ibuprofen, which is what they sent me home with. Ibuprofen and Percocet. I did not touch the Percocet. But I would take the ibuprofen, and sometimes even when I didn't need it, just to kind of, as a precaution, just in case. But then it came to a point where I just did not feel pain. No cramps, no pain. So I just stopped taking it. That would have been since last week, Tuesday. So at the 2-week mark, I stopped taking ibuprofen. I'm trying my best to walk upright. As of this week, I've started to wear the abdominal binder. I don't have it on right now because it's not the most comfortable thing. I don't like waist trainers, so I don't like anything around my midsection. But after I get off of this, I'm going to put it on and sit in this couch and probably take a walk later. But overall, after coming out the hospital, recovery has been amazing for me. It really has. And I thank God so much for that. I've heard so many horror stories. I know how things could have gone, but this has been pretty good. And if you guys have questions, please ask them. I'm not trying to portray a pretty picture of this. I really am not. I know that I have a higher pain tolerance than most. I know this. But I honestly feel that my doctor's work is what's causing me to not have as much pain. Last Thursday, this is Monday, so last Thursday, I went to him. He checked out the cut, and he said, I've pretty much healed. So he was able to take the tape off. I feel it. I feel the difference in my body. I haven't had a fever since. Low grade fever every now and then, but when I take it in the morning, my fever is perfect. And I feel good. That's all I can say, guys. I do feel good. My dad looked at me yesterday and he said, "You look so pretty." He said, "You look so pretty. You just look nice." It made me feel good because I know that I wasn't looking so good. I wasn't looking so good. Especially after the miscarriage. I just looked puffed up. But yeah, God is good, y'all. God is good. I have a long road ahead. My husband and I have to wait 6 to 9 months. And my doctor said he recommends a 9 before we try to conceive again. But even with my myomectomy, like I'm not sure what my body's gonna do after this, right? So if anything, in the next video, I'll show you guys how I'm eating now. Maybe the walks that I go on or the light workouts that I do, because I still can't lift anything heavy. And also I'm gonna do a video when I go back to work, right? Right now I'm on leave of absence, but when I go back to work, how is that gonna be, right? How is that gonna be? Because going back to work after my miscarriage, it was taxing. It was very taxing. Daily, you put a smile on your face, but then when you come off, you're like, thank God, I just need the mental break. So we'll see how it goes. You guys are also gonna get a vlog. I'm gonna do a vlog, y'all. A week in my life. We were trying to do a weekend, but it's gonna have to be a week because I don't do much right now since I am in recovery. But we had a weekend that was filled with a lot. But yeah, that's my myomectomy surgery so far. You guys are gonna see some clips plugged in here, so darn it may be on the 29-minute mark. It may be. I'm sorry guys for these long story times, but ask me some questions. Also give me feedback. Let me know some of the things that you want to see, especially those of you that know me, but yeah, that's my myomectomy journey vlog. The next one that you guys are going to see, I'm going to talk a little bit about just how I'm feeling. April 9th would have been my baby's due date. I think I told you guys this already. I might have forgot. So I'll let you know once that date rolls around if we do anything special or just how I feel about it. We'll see. Well, guys, if you have made it to the 27-minute marker or however long this has been, I'm grateful. Thank you. I'm trying my best to stay consistent. Might not be story times moving forward. It might be other things, like I said, weekly vlogs, maybe chit chat. Maybe I might have my husband come and sit down so you can hear how he feels about everything that's been going on. I think that might be a good one. I'm gonna do that. But you guys have a blessed day, and I can't wait to chat with you again. Bye.